For any of you who are urologists in the audience, in the last 6 months, we got an iPhone app. It's called UW Pen. It's an iPhone app that will actually is programmed to take pictures of the penis for the patient and then send it to you in an encrypted form direct to the doctor's email office, and you can and it comes as a PDF file and you can scan it and keep it, and I can give you the URL if you want. It's available for free. Now, at visits 1, 2, 3, all patients completed the IEF-5 score and had a physical exam. Education followed regarding technical questions. Procedure of the same visit we repeated. And prior to the study, each subject signed a written consent form approved by the ethics committee, and I gave them the equipment for free, and all I asked them to do was follow my rules for 6 months, and nearly all of them are happy and still using it. So this is the IEF score. It's fairly simple. You can get it online, you can print it. Anybody who's a primary care physician can use it to actually counsel your patient, to help assess improvement in erectile function, and also use it, like the previous speaker said, as a way of picking up early CVD or cerebrovascular disease, so that you have to ask targeted questions to the patient. It's very rare that the patient will actually tell you he has ED. Men are very, very ego conscious. You have to dig it out. So this is the device. It's spring loaded. It's easy to apply. It's not rocket science, even though I've got the space shuttle up here. That was only because I talked about the future of medical education, and I wanted to tell them that space age technology has come to medicine. It's very simple to use. As I said, I have to apologize to the women. I have to show you lots of pictures of the penis, but it's from a scientific background. So what are the treatment periods? There's an adaptation period for 2 weeks, and then an evolution period where they serially add attachments to the device to lengthen the penis. Any deviation from the treatment program could alter the results, so they had to follow a strict regime. So this goes through what they did. The most cumbersome part was the fact that they had to use it for 6 to 9 hours a day. It doesn't have to be all at once. They could do 2 hours, 2 hours, 2 hours, or 3 hours, 3 hours, 3 hours. As long as 9 hours was completed in a day, the results were exactly the same. And simple rules: they couldn't wear it while they were sleeping, they couldn't wear it and play football or cricket, they had to take the device off when they had to urinate or defecate. I mean, most of them are fairly simple, but when you're doing a study, you actually have to have everything in black and white, especially in Australia, otherwise I get sued.